Ingrown nail. So this patient has had an ingrown done before, and based on her history, but you can see it's coming back. And she actually had, or she was told that she had the chemical matrixectomy. What the chemical matrixectomy is when we put a chemical back there, so it prevents that nail from growing. But you see the nail is coming back, and because the skin has kind of modified to not having a nail go over it, kind of like this one, the skin has grown over the nail. And so as this nail is growing, it's pushing into the skin and causing pain. In one of the videos that I posted, someone made a comment and said, I would never go to this doctor. This is unnecessarily aggressive, and she's being so aggressive, and I don't understand why. And I'm hoping to address that here, because the reason why we have to remove and really go in is because if you do not take out that matrix, the matrix is what produces the nail. So you see all the nail there? That's nail. It will come back. You could put chemical there, but part of that, quote unquote, which that person or anyone else may be calling aggression, and I've never seen it bleed and all of that stuff, is because we have to take that nail out. If you don't follow the post-op from, other doctors, you may really never know if this patient still has pain or if it comes back or anything like that. So anytime you watch a video and you see a snippet, there's much more that happens in the before as well as the after. So I have seen lots and lots of times patients have had ingrown taken out and it comes back. You put the chemical and it comes back. This is another example of the patient. As you can see, you can hear me, so this patient doesn't feel any pain or anything like that. So we take this nail out, but then there's still a matrix back there, okay? And part of what we're doing is removing that matrix. So we've removed the nail, but there's still a matrix back there that is producing the nail. So this is a little short nail. It's not as long as the other one, of course, because that skin was in the way. So now when you see me go in with a curette and try to curette this out, and you say it's aggressive, it's because I'm trying to make sure I destroy that matrix so that this patient doesn't have that nail grow anymore. They don't want that nail to grow anymore. And so that is why I am doing this. And that's why when you say it's aggressive, this is what is happening. We are literally what we call debriding, which means removal of the tissue. So this is a mechanical debridement, removing that matrix from there. There's no nail, as you can see, but again, the matrix is, again, a collection of cells that produces the nail. Afterwards, in addition to this debridement and mechanical removal of that matrix, we then put a chemical. That chemical will then really help us to prevent that nail from coming back. It's a chemical burn, and we use, you can either use sodium hydroxide or phenol, and so it causes a chemical burn to burn all the cells that are producing that nail. Remember, we're not doing it to the whole nail, we're literally only doing it to this section right there. And so when we do that, that reduces the chance of that nail growing again. And so this patient shouldn't have to deal with, an ingrown toenail or anything like that. So that is a process of an ingrown removal. It's not just removing it. And that's why when you go to the nail shop and get it done, they, first off, only remove partially because they can't remove the whole thing. And then it's going to come back in 2 weeks. So this is what gives you that, permanent solution so that you don't have to worry that that ingrown nail is going to come back and cause trouble and cause issues and things like that. If you have any questions, leave it in the comment section and be polite and leave, I hope this helps understand why I have to remove some of that matrix, because or why I have to be quote unquote aggressive. And as you see, that blood that you were saying, oh, there's blood, I've never seen blood. There's no blood. There's a tourniquet there, and that's controlling the blood. If the tourniquet wasn't there, the blood will come out and actually mess with the chemical, and we won't be able to perform this chemical matrixectomy, which is what we call it, a clinical term. If you have any questions, like I said, leave it in the comment. All right, bye.